At the time, I didn't know I was bipolar. I would say that it would have made a difference if I knew the fact that I will get addicted much more. So on average, we have about 4 times more chance to be addicted when we are bipolar because our brain is not wired the same way. From Yale to the front line, we're syncing addiction and bipolar care with Dr. Zola Chihombori Quao. Hello and welcome to Bipolar Talks, a space to discuss all things bipolarity. I'm Clément Bessa, founder of Upstage, and our mission is to transform our bipolarity into an opportunity. We're lucky to welcome Dr. Zola Chihombori Quao today to talk about addiction with someone who advocates for human rights, also a great psychiatrist who've been 3 years. So we're gonna talk about the intersection of bipolarity, addiction, and underserved care. And I just let you present yourself.
Yes, thank you. And it's such a pleasure to be here today. Nice to meet everyone who's listening. I'm Dr. Zola Chihombori Quao. I am a psychiatrist. I'm also trained as a family physician or GP. And I love being able to integrate different specialties and methods or thoughts or schools of thought for treatment because I don't believe that any person or any brain, they try to fit into the textbook, and everybody is an expression, a beautiful expression that it just needs to be understood. And so I'm very happy to be here. I love taking part in conversations that help educate and empower people. And so thank you very much for creating the space and for inviting me to join.
Yeah, it's a pleasure. So you did a lot of things, but one thing in particular is really important for us as bipolar is understanding addiction. So to share a little bit my story, I was addicted to weed when I was younger, when I was a student. At the time, I didn't know I was bipolar. I would say that it would have made a difference because if I knew that the fact that I will get addicted much more. So on average, the data depends, but what I have is like we have about 4 times more chance to be addicted when we are bipolar because our brain is not wired the same way. And so yeah, it's a big thing for me about like how to not become addicted again,
Mhm.
not only to weed, but it could be to other things. I feel my personality and the way I am. So I'm sharing my story, but I want you to tell us like a bit the science behind it. What is an addiction actually?
Yeah. And so when we're talking about addiction and definitely keeping it broadly, we all just think about a reward system. There is something, and I want to start with that because there is something that people are getting that there's a lack for in some place in their life. And so there's some sort of reward, and then there's that increase in dopamine, that, happy, good feeling chemical. And then whatever it is, that thing that we're doing, our dopamine becomes more dependent upon this thing, whether it's coffee, whether it's maybe even our work, maybe it's sex, maybe it's alcohol. It could be any number of things. And people, could even be addicted to like eating laundry detergent. So there's TV shows about people that have any number of addictions. And so, but the chemistry in our brain remains the same. And so that is helpful when we're trying to understand how we then take control of our dopamine circuits and also regulate our brains so that they're not starved for dopamine whenever we're not around that thing. Because what happens then, we don't have that dopamine surge, or we're using a lot more dopamine. There's less dopamine that actually is even circulating around in our brain. And so it is more difficult to maintain a stable mood. It is more difficult to get out of depression. And in the case of bipolar disorder, those changes in, the dopamine in our brain and all sorts of different neurochemicals, it does end up being extremely destabilizing for folks that have to deal with bipolar disorder. And so there are a lot of different, I would say, vulnerabilities for folks with bipolar disorder, and vulnerabilities to addiction. That would be some, particularly in more manic or potentially hypomanic episodes. And those are episodes where there's a lot of high energy. The brain is really firing a lot of um, excitatory neurochemicals and neurohormones. And so there's a lot of energy, seeking, talking, and searching for those rewards and feeling really great off of those rewards, and then really trying to keep it all going. And the point of even trying to manage the manic episodes and the addiction is that they both have risks that are either related to disability of some sort, all of them with social harms, and then at their greatest extent, sorry, if I didn't already say disability, and then at the greatest extent, death, even death, because substance use disorders, many of them, although, well, I mean, I guess some of the addictions have other harms. Maybe they, won't kill you, but the substance use disorders, they have the impacts of the social harms, whether it's negatively impacting your mood around other people, your relationships, your ability to maintain healthy relationships by being the same person generally and being loyal and dependable. As a friend with many substances, there's the harms that come with not just our brains and our bodies, but how we fail to take care of ourselves, or to take care of inebriated or otherwise, or numbed or detached from the world. And so when we're not taking care of ourselves, or we're just detached from reality completely, there's a lot of nutritional deficiencies that folks will have related to substance use disorders, increased infections because the immune system is a lot worse, hygiene's a lot worse. Sometimes there's greater exposure to certain things. And then there's also the risks of death with combination with certain substances, opiates and alcohol, benzos and alcohol. Particularly if we're just kind of really disinhibited, we'll just take whatever anybody gives to us, and then potentially that can cause that risk of death there. And then there's the long-term health risks, because all of these substance use disorders also have long-term health risks. Where for methamphetamine, there's risks for heart attacks, not just heart attacks, but also heart failure, and also neurological or cognitive impairment, and also psychotic disorders. Even after they stop using methamphetamine, for bipolar disorder and addiction, um, the issues with addiction there is that bipolar disorder on its own, these really low lows, which are the depressed episodes, and the really high highs, which are the manic episodes, both of those are actually really toxic to the brain. And MRI scans of individuals that have had repeated episodes of depression and bipolar mania that have not been treated over time, their brains are smaller, particularly the gray matter. That's the kind of the outer layer of our brains. That's the kind of the plugs. And then the white matter is the wiring, are all the things that, like, even for here, this would be, the fat that is on the wiring. But the gray matter would be what actually is, what we're actually connecting to. And so those folks have less gray matter in their brains, and particularly in the prefrontal cortex, where we have decision making, and also the temporal cortex as well, excuse me, where we store memory and we have memory processing, and in other areas as well. But those are very prominent areas. And you can imagine that as you are older, or as you're getting older, um, having issues with memory, having issues with planning, ordering different decisions, when you're mentally impaired because your brain matter has shrunk and it's gone away. There's a loss of protein really in the brain, but when that's gone away, that is really disabling for people, and it really further complicates the aging process. And addiction does very similar things. They will, depending on the addiction, the substance, whereas what I mentioned before with methamphetamine, for instance, where there's the psychotic disorders, alcohol can cause psychosis as well, but it can also cause issues with movement and walking and vision and confusion. And so people will start having problems walking and neurological disorders that will start to onset very late in the course of alcohol use disorder. So, untreated addiction, untreated bipolar disorder, both of those can have really disabling long term effects on the brain in the long term, and then in the short term, and there can impact our health in the more immediate term, our relationships, our stability in life, and also, still put us at risk of an earlier death than an otherwise healthy person would have experienced.
Yeah, that it makes me think about a lot of questions. One of the things I want to share is I think it's tough to be able to share that you're addicted. And it's not easy to go in front of your psychiatrist or your GP and be like, I'm addicted to this drug. And it doesn't mean saying it will make you stop, but at least it will know how to give you treatment that is not going to be affecting your addiction. Thing is like, it's a really difficult thing. And I remember at the time I was in depression phase. I was smoking weed, so not a good mix for sure.
Mhm.
But but I think it's important to say where I was because you could be in the same situation thinking there's no way around it. And what I wish I knew was I could have said it to my psychiatrist at the time. I could have said, hey, I'm in depression and I'm also smoking, meaning like whatever you're gonna give me, I don't want it to have an issue. And at the time, I wanted to keep smoking, so it was a tough conversation. So I wanted to share that, and maybe you want to react actually.
Yeah, and it's you're describing an experience that so many people have when wanting to be open about something, but really having a lot of potentially valid reasons to not share, but some of them are more emotionally based. I think some of the more valid reasons for not wanting to share is that people might fear how whoever they share it to will treat them differently, will look down upon them. And especially in the medical field, that might be something that they might have even had experience with, right? And so having somebody, being able to find a safe person to disclose that to is a really huge thing. And one, if you don't feel safe to disclose that to your psychiatrist, then or your GP, whoever, then you should have somebody that you should be able to disclose it to outside of you. Uh, I think it's important to share, even if there is that fear, because as you mentioned, it's important to know if there's going to be any interactions. But if you're trying these treatments and things aren't really working, there's going to be another aspect to that another piece to that puzzle that will always be missing. And if there is a substance that is there and meant to replace something, whether it's, anxiety or it's a really social thing or, it's just a habit that tends to take more from, a person than it really gives them. Um, and to them, it feels like a problem, then it's really important to start that process of being able to openly admit it because that first act of humbling yourself and accepting, hey, this is something that I'm not able to be in control of and I need to seek help with this. Everything that I've been trying on my own isn't working. It's a spiritual act in a way. It requires, saying, hey, not I'm not done well. I'm not achieving. I'm not somebody that's eating clean, eating healthy, no toxins in my body whatsoever. I'm somebody that is more tired than I want to be, unable to, show up for my friends and family or work. I'm dependent on this thing and I'm an asshole if I don't have it, whatever it is, they've realized this thing has a greater control over them that they would not have wanted. And it's only at that point that people are at that point where they're ready to make changes because a lot of addiction is in secret. It is in the hiding and it is in the silence. And that is what perpetuates it. letting go of that need to shelter from that truth is one of the necessary ingredients for actually dealing with addiction in a way that, this person might feel successful. They feel as if they have control of themselves again rather than them, their mood, their ability to think or be around certain people, be dependent on their access to this thing.
Yeah, and I feel one of the toughest thing, at least for us as bipolar, is like we cannot do it the same way as everyone. I figure out that most people, I would say, like they can drink alcohol and a little bit, maybe like once a week, like have 2 glasses of wine, and it's not too bad. But for most of us, it's not going to have the same impact. And for me, it was hard to accept that some of my friends smoke weed maybe once a month. But even if I do it once a month, the problem is like my brain is not wired the same way.
Mm.
And it will be really tough for me because I will want more or I want to consume more than they do. And I see that a lot in our community where when most of the people I know have been stable, I would say, they almost don't consume any substance. And when I say any substance, like for myself, for example, like even coffee is like, it's too much for
Or
me.
the rapidness with which people consume coffee and talk about how they hate the world unless they have coffee and will drink 3, 4, 6 cups a day. Bless their heart, bless their blood pressure, bless all of their vessels. And I hope that I hope they're doing the other things to counteract it. Yeah. It's the conversation on addiction should be broad. And even with your friends, it should I hope it's a topic that, would be something that could be discussed among friends, but I know that society isn't always like that.
Yeah, it's tough because I feel like a lot of drugs, I consider alcohol as a drugs because I don't like to separate it from it.
It doesn't
And
yeah.
and everybody's like, it's noble, kind of. And even like the social pressure, which I feel sometimes like I've been there a lot of time asking people like because I used to live in France like a few months ago and I live all my life in France. And it's kind of culture thing to serve wine in the table. And
Mhm.
people won't ask you before they pour the wine into your glass. And that's tough. Like when you have like problem and addiction is very tough. Like how do you manage a social gathering? Because I feel it's not an easy thing. What advice do you give to your patient?
Quick break. Can you let us a review on Apple Podcasts or the platform of your choice? It really helps us break the stigma around bipolarity. Let's get back to the episode.
Yes, and so it depends. It really that's I like having these conversations because these are difficult conversations. One, it's there. There's plenty of use is normal. I think that everything on the planet exists on a spectrum from food to medicine to toxin and everything in between. And the kind of toxic dose for different people is always different. And maybe it's not necessarily a toxic dose, this glass of wine, but it is toxic in the way that it is not giving back to you. It takes more away from you and actually puts you at greater risk rather than something that's actually nourishing to you. And so if there was a greater culture around discussing how we're managing our intake, whether it's what I think there's some conversations about our consumption, but alcohol consumption and how difficult it is to step out of that. I want to acknowledge how challenging it might be, especially depending on whether if you're very open with not wanting to drink, or if and people around you know, or it's something that you don't want to shed a spotlight on. Maybe you just want to be at a work gathering and to very quietly decline alcohol and let that be your night. With patients that might be struggling with alcohol use, really struggling with anything that, um, again, has taken more control of their life than they wanted to. Like they've decided for them that this is not okay. So it's not me saying like, oh, they're drinking too much and that's bad. Da, 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 da. Because they're, to kind of the point that, oh yeah, these things are normal. Like people taking part in substances, it's not an alien thing. It's something that I want to acknowledge can be done safely. However, as I said before, toxic doses for everybody remain different. And it's hard to accept that maybe I'm one of those people that has a lower toxic dose with this thing. It really sucks, especially when everybody else seems to, be able to kind of roll through it without any issue. So when we're to this point of having that kind of spiritual shift and saying, yes, this is something that doesn't feed me, doesn't feed my soul, doesn't feed my spirit, my body. I don't feel like it's helping me. Then we're getting into really deep shadow work, really deep emotional work. What does it mean for me to not take part in this kind of quote unquote normal world? But first, we want to smash down this idea that the world is normal at all. There are things that are common and less common, but it's all normal. It's all human. And I always suggest that honesty is the best policy if anybody wants to, say anything. And you can even, putting like turning your cup upside down or putting a napkin even over top of it. If it's a situation where we're not going to have conversation anyways, then I'll signal in some other way that this is not what I want. You can find, somebody, ahead of time saying, please, could you just give me cherry juice or just give me, Coca-Cola. I really, and there's any number of reasons why somebody might not want to be drinking alcohol or be taking or eating meat. Even, I'm somebody who doesn't eat meat. And so I always have to go through that process anyways when I'm going to some sort of prefix menu, and I have to make sure not only if the meal is vegetarian, but then I have a couple of food allergies as well. Avocado being one of the most annoying things to be allergic to as a vegetarian. But it requires a certain amount of verbal and nonverbal communication that can get you through those situations. If you want to lie and you don't want to really go through it, you say, I'm, eating more clean now. I'm not drinking now. I'm doing a cleanse, which is so very common to say you're doing a cleanse. I'm trying to, I'm trying to conceive, whatever it is, people ultimately don't really they aren't entitled to any sort of reason, but it can be difficult to feel empowered to just say, I don't want to drink and leave it at that, because no is a full sentence. But I know that for plenty of people, that can be really short or cold, or it, you feel like you, again, deserve to over-explain or explain why you're making this choice or decision. But ultimately, it's your choice, it's your decision, it's your body. And most of the time, people won't really take notice. Potentially, if you're a woman that's not drinking, they'll say, oh, are you pregnant? Then, respond as you wish, but it's one thing that really you might be surprised that people do respond well to is that when people are open about not wanting to drink, and they actually are modeling a brand of courage that not a lot of people get to see, which is, choosing something that is against the grain, but that everybody knows is not necessarily the most nutritious and nourishing thing on the planet. And it will be telling the people who want to put you down for not drinking or react negatively to you, because that is somebody that is a more toxic person than is a more medicinal person in your life. Because a lot of times when I talk to my patients about intake, consumption, what they're taking in, it may include conversations around substances, but it will always and very frequently try to see if there's any person in the environment that is similarly toxic or medicinal, Because the environment, we are taking in so much from our environment as well that impacts how we feel and how we're able to sleep and whether or not we're able to enjoy natural light. There are practices that, like maybe social, being on social media and, taking in a lot from, um, ultimately people just, play with a platform, but being really potentially harmed or moved or upset by what is being consumed in the media. These are all things that hopefully are a part of this development of who am I if I am not taking part in XYZ, activities or substances, what kind of person am I? Am I not doing these things? Is it just me? Was it the substance that was an excuse? And am I at the bottom of these things? I'm really just afraid to do, whatever it is because I don't know, I'm afraid to fail. Whatever it is, people are hopefully walking a journey that isn't just about their relationship to a substance, but how that relationship to that substance, how it impacts how they view themselves, how they view the world, how they view other people, and really crafting more of your personality outside of it. And that's something it is built up brick by brick. And it's worthwhile for people to be able to live in that and then also be able to live in that proudly because it is very difficult work. So yeah, I hope that being able to stand in that truth and model that for other people also helps educate and empower them to support others in their lives to do the same, whether it's them or a family member. It's a lot of everybody knows somebody who's dealing with an addiction of some sort, and you can only do so much for this loved one, but being a safe place and person to disclose and discuss things to is the first start. So yeah, I do encourage my patients to bring people in to the struggle. You're not a burden. People want to take part in it. And yeah, you might be surprised with how you're received. And then your reception will also give you valuable information about the people in your life and whether or not they actually truly care about your happiness.
Yeah, I feel like people want to help more than we think. And I'm usually surprised, like, when I say, for example, like, I'm not going to drink tonight, says, like, most of the people, if you are confident about it, then they will be like, why am I drinking myself?
It's very frequently what happens, like, "Oh, I'm not gonna, drink so much," and because people have a sense that I do wanna take care of myself, I do wanna be a good steward of this body that I've been given, and so the one body that I have, control of in this earthly realm. So it's not that crazy of a thing.
Yeah, it's the opposite, which is a bit crazy, but it's how society is. So something which I would like to understand a bit more is like, how does it work and why are we getting addicted? So you talk about it a little bit, but
Mhm.
I think that because our brain is just so mysterious,
Yes.
and so why are we like this as human?
Mhm.
And yeah. So, and what can we do on the science spec? Because I feel we talk a lot, which is really important, and like asking for help, talking about it. Then what do you do when you do that, and how your brain works, and how you help your patient do the process when they are starting this actually?
And so you're asking about how the addiction develops, particularly in folks with bipolar, and how do they start, I guess, targeting a treatment or I want to make sure I'm understanding your
Yeah, no, I'll do one question at once. So, what happened to your brain with addiction? Why? What is going on?
yes. And so I mentioned this molecule dopamine, and there's just reward circuits within our brain. And a lot of reward circuits are, I would say, evolutionary. There's reward circuits for food. And so we'll have a normal kind of baseline level of uh, dopamine just flying around. But then once we have a meal, then that dopamine level spikes because we're getting that food. It's really good. And it encourages us to not starve. It's like, and we're enjoying this food. Similar bumps happen, during sexual activity that evolutionarily promotes reproduction. There are some similar bumps that happen, with exercise that's supposed to increase, the strengthening and activity. But when we're engaging in addictive activities, then we're in this high, we really enjoy it. But it does tend to wear off. And the more addictive substances have a really high, like a really quick high up, and then you crash really quickly and crash really low. Some of them, then you have to end up using more, or more frequently to get a similar effect. Alcohol is one of these substances. Heroin and fentanyl, the opiates, are similar to this, methamphetamine. And so what is ultimately happening is what is typically just hardwired in our brain to, one, help us keep ourselves alive. But the second purpose of that reward circuit is actually learning and, having this like feeling of accomplishment or motivation. It helps us continue to do things. And it's like, oh, this thing gave me a good thing. Let me do more of that. It's how a lot of children are taught, trying to help them learn things in its more positive way of learning rather than the fear-based learning that otherwise takes place, or not otherwise takes place, but that can take place. But so this reward circuit, which previously was, at a kind of a normal spot in the brain, or normal function in the brain, and the parts of the brain that are dealing with, just reward circuits. I think it's, like maybe the locus ceruleus. Maybe I need to look up on my neuroscience at this point, but it starts to become an overpowered circuit in our brain, and more energy and attention is put towards that circuit at the detriment of other parts of our brain. And so our reward circuit is now directing a lot of attention from maybe our prefrontal cortex, so that a lot of what we are focused on even is finding that dopamine fix. Because when we're down low, it's not, before, our circulating dopamine would be at a, maybe, I don't know, I'll just say 100 just to make it easy. We'd be at 100. But now if we're in this consistent phase of looking for, this dopamine shift, then once we kind of expend so much of that dopamine, and we go to that crash, then we live at a lower sort of dopamine level. Maybe it's like at 50 rather than being at 100. And it can be uncomfortable. And so what do we do? That thing helps us feel better again. There's a lot of there are many things actually that increase that dopamine level. But once we start of just coding in that this is the thing, this is the thing, this is the thing, that's when the habit starts to form, and it becomes more of a reflex than of a response. And then and not all addictions will kill you, but in the case of alcohol, addiction specifically, if you were an alcohol and benzodiazepines. Say if you're an alcoholic, you're addicted to like Xanax or Valium, and you are on those medications very frequently. We don't ever advise those people to just stop, because the withdrawal for those addictions could actually kill you. And what's happening with alcohol withdrawal and benzo withdrawal is that, our brains are basically a seesaw between the excitatory neurotransmitters, like the glutamate neurotransmitter, and the inhibitory neurotransmitter, the GABA neurotransmitter. And they're supposed to just kind of work, as we're more excited when we're awake, more sleepy when we're about to go to bed. It's an interplay that is just supposed to work across the spectrum. However, when we're overexposed to alcohol and benzos, which specifically further depress the GABAergic, or different parts of the GABA neurons and the GABA neurotransmitters, I should say, are the excitatory part of things is having to do so much more to try to just keep everything level. And so when you take those things away, when it just been used to just so much depression, so much depression, so much depression. And it's like, so much exciting to try to keep this person, up and awake. It actually just goes into overdrive, and those people will have really fast heart rates, really high blood pressure. They might start having like confusion, and they, ultimately have like delirium tremens, seizures, start, seeing things, hearing things, and it ultimately is a neurological crisis that would ultimately end up, would lead to their death. And so each addiction is not the same. Say, like, somebody went from, I don't know, like dabbing 24/7, while and just trying to cut off cold turkey. They might experience behavioral and some symptoms like headache, maybe nausea, maybe they're have trouble sleeping, but it's not ever a withdrawal process that will kill you. And so there's similar things that are happening kind of on the I would say the reward side, but there are some substances that actually might do more or less to your brain, to your heart, to the liver or the kidneys. And so and then some have higher risks of infection, depending on how it's taken, versus like IV drug or snorted or what have you. So that, without getting too specific on one substance, but generally the habit forming kind of neurology, it technically is the same for many habits. And just there's some habits are seen, societally as positive. And so, if somebody's addicted to working out, they're not really going to turn too many heads. Although I did watch, a reality documentary about somebody who was addicted to working out and had had a lot of social impact, from that. Spent a lot of time in the gym, did not see any family or friends, took more and more steroids, was having heart problems, and still just wanted to get bigger and bigger and bigger. And so being aware of kind of that balance of what is this social impact? Is it all positive? Is it is there some negative? How much negative? Can I handle this negative, or is this really truly for me not okay? And a lot of people struggle with actually having that appropriate um, assessment for themselves, like being able to analyze whether they're okay or not. Which is why, bringing in a support system of some sort, having somebody else that can tell you, hey, you're not yourself. These are the things that we have talked about, or if you had pre-planned, of course, these are the things that you had wanted us to look out for. These are we wanted you to be able to get some sleep. We wanted you to, if you're going to start feeling paranoid about your neighbors again, you're going to let me know. And we were going to see, is this something that we really truly, that is a threat? Or is this, something that we know might happen, that you might get paranoid about them implanting devices someplace? And so having some internal signs and symptoms that you look out for versus also having another person that you can trust, that will also be helping monitor and assess, are we in this threat level? Or do we need to be worried? These are people that are, just like a part of the safety plan, a part of your community, a part of helping you help keep yourself healthy.
Yeah, I feel like one of the toughest thing, at least for me, is like usually like how do I replace this addiction with something else? And it's always like, how can I find this high kind of?
Hmm. Hmm.
And I feel like it's never easy, and it's about like managing your addiction, I would say, at least for me. It's like I would say, okay, maybe I'm a bit addicted to sport, maybe a bit to sex, maybe to game, maybe to and if I have like a sort of normal level on
Hmm.
each of those, I'm like, okay, I still get my high, but then it's not a problem.
Yeah, and and you're not demonizing wanting to feel, that like high mood, that elevated mood, but it requires a lot of patience and potentially creativity to finding those things and what sorts of experiences really fulfill me in a way that possibly even the substance didn't either. Because many substances make it a lot easier to be alone. It makes they make maybe a lot easier to not really truly connect with people and just kind of be out drinking and really liking the same songs and music maybe at the dance club, but not really knowing much about them, whether they ever had any siblings or contact with their parents or um, if they're even sleeping. I think that most people don't, well, I would say, no, let me back up. I would say that some of the things that the substance helped with are easily replaced. They just don't have necessarily, they're not as easily sort of like reached for. And so that ends up being a slight difference because there's not always a friend that you can call up and go on an adventure with. There's not always an activity that you have in mind, but it takes about, most cravings, whether they're happening, they can happen. Maybe they'll last about 20 minutes. That's generally what we talk about in addiction spaces. And so you got to find something in that 20 minutes to avert your attention. And also hopefully something that's just as fulfilling for you and just as exciting. Of course, that 20 minutes could happen again like 10 times in a day, but being realistic with yourself and understanding what the triggers to use are, why, because a lot of times it might be difficult conversations or, it's another sort of avoidance that you say, oh, I'm feeling like I want to do this now. I'm really trying to avoid this thing. It really ends up being, your activity rather than doing the thing. Your activity is asking yourself what is uncomfortable about not doing that thing. What are you learning about yourself by not doing that thing? What do you not like about yourself when not doing that thing? What do you like about yourself when not doing that thing? And so the process, the act of studying yourself becomes the process more than the substance would be. But it is, a lot of times folks find other things to be fulfilling, and that's not a bad thing.
Yeah, I'm watching the time, but I think I still have so many questions. Maybe we will do another one. My last question would be like, if you had a magic wand, what would you change in mental health?
Ooh, what would I change in mental health? This is really difficult. I think that I would, there's so many things. I would start conversations about difference in mental health, neurodivergence, learning style, all of it at a very young age, all across the land, and empower young people from an early age to understand how the brain works, how emotions work, how behavior works, and how to describe their emotions, and to be able to express emotions in a healthy way, whether that's being, happy, in a healthy way, or expressing tears, in a healthy way. Which like most of the time, well, I guess there are technically unhealthy tears, but I'll just say yes, in a healthy way, because I do want people to be able to cry openly. It's not a bad thing to cry. And it helps signal to other people, to cry, but I don't, the society that I want to help bring out into the world, is a society where people don't feel shame for crying openly. And they don't feel shame for feeling the full spectrum of emotion.
Yeah, thanks a lot. It was awesome. Thanks, Zola.
Yes, thank you so much. And if anybody wants to be in touch, I am on LinkedIn. That is, where I can be reached. I'm also on TikTok currently under at Zola Powered, and my website, drzolamd.com, is forthcoming. And so maybe by the time this podcast airs, it'll be available. But there are multiple other ways of contact. But I really do love the work that I do, and I am happy to connect with folks in this space and to help to continue to educate and empower folks with any sort of mental, physical health concerns. I think that we only heal and what we heal well when we heal together. And I am really proud of the work and love to do it. So let's continue the conversation.
So I do a quick outro, like 30-second, but I think you almost did it. So it's
Oh, shucks.
yeah. So what we learned today, and it's not easy conversation, is like what is addiction, which is pretty common, and we learned that this is how our brain is a bit wired, and we shouldn't feel ashamed. And what we have the courage to do is to really like talk about it. And maybe that's one thing I want you to remember is like, feel free to talk about it with your friend, with your psychiatrist. And there's a solution out there and there's hope. And so thank you for listening or watching.
To learn more about bipolarity, go to our website, upstage.com, HOPESTAGE.com. See you soon.